7:41 and a half in Trinidad and Tobago. Staying on the topic of World AIDS Day, today is the 27th year for commemorating World AIDS Day, and as we discussed with Brother Hari Prasad Maharaj, it's moved away from being an automatic death sentence to a manageable and treatable chronic illness. And while this is encouraging news to many in the healthcare sector, there's still a continuing call for more to be done to stop the spread of the virus, as statistics show that 35 million people remain infected worldwide. To give us an idea of the situation locally, we are joined now by Dr. Ayanna Sebro, Deputy Director of the HIV/AIDS Coordinating Unit. I should mention that we were expecting as well the Minister of Health, Terence Dayal Singh. We did get a confirmation from the Corporate Communications Officer in the ministry, but he hasn't been able to make it for whatever reason. But we do have Dr. Sebro here with us. Thanks very much for joining us. Good news, bad news, what is your perspective as far as AIDS awareness, infections, the overall state of play in Trinidad and Tobago right now?
Okay. Morning, Fazeer, morning everyone. Apologies on behalf of the Minister. In terms of where we are, I think with respect to the epidemic locally, we have the opportunity to really reflect at this point. After 27 years, we've made significant gains. We have a large amount of treatment sites, and we are seeing persons coming in and using our testing sites. But one of the things that we do notice is that we seem to have to move into new areas, to look at testing of men in a different way, and testing of some of the more vulnerable groups, to really see how we can really reverse what's happening with our epidemic locally.
Is that still a concern, the issue of while maybe, as I had the discussion previous with Brother Hari Prasad, maybe fewer people are dying, but the rate of infections is, and correct me if I'm wrong, I think the latest data that came from the United Nations and other organizations talked about still their concern about the rate of infections in our Caribbean region?
Locally, I would say that it appears as though, from some of the data that we have from our testing sites, that we are seeing some reduction.
Okay.
We are beginning to see some reduction, but it begs the question, because my role is to look at the data and say, what is this data reflecting? Are we testing more people? Are people actually coming into the sites? And so one wonders who's not using our testing sites.
Right.
And so, you know, I've had the opportunity to take some look at the data over the past couple of years, and I noticed that consistently we've been increasing. We've gone from testing 10,000 women to over 50,000 women a year, but we always seem to stick at about 20,000 men. And we get equal rates of men and women coming forward positive. And so that means that we need to make some inroads with some of the...
What do you think needs to be done? Because again, it seems to come back. I don't know if it's the classic macho syndrome and I don't want to know, I'd rather not know, and so on. I mean, it takes some research, it will take some data, and unfortunately we aren't a society that is that big on doing the research and getting the data. Have you been able to get any reliable information as to maybe why men who may be in vulnerable situations that could have them testing positive are not coming forward? Is there any reason why, from your understanding?
There would be, because I think it's difficult to put all men together in one group, so that you would have different groups of men that would access services in different ways, and it begs the question whether we are really reaching out in the way that we need to the male population. And
should the message be presented any differently? And should it target markets or anything like that?
So those are some of the things that we're looking at in terms of targeting population. So, for example, there are people who where health is not the first thing on their mind. They may be more interested in making money so that they could get food to eat, or they may be substance users or various other things. And so it would be for us to meet them where they're at, to move them along to the point of testing and seeking treatment for whatever their other issue is, in addition to what their health issue is. So that is some of what we are looking at.
And as we are on this World AIDS Day 2015, as you look forward, I mean, with those different specific challenges as to the number of men to get tested and the different issues related to that, any recommendations, any suggestions that you would have as to how you could move the process forward so more people would be willing to come forward in that regard?
That's a tough question.
Oh, it is. I mean, I'm trying myself to try to come up with what sort of strategies. Is it about bombarding people with information? Is it, some will say, as they say, when you see the cigarette packages with all your lungs and so on, that is supposed to scare you into coming off cigarettes? Can that work?
I think one of the things that we've been, I'm not a man, so I don't know, but is to basically ask the advice of the male network. Whereby, for example, those men who are coming forward, each one bring one. Talk to your friends about HIV and AIDS. Talk to your friends about some of the other issues. So, for example, men do positively reinforce men or negatively reinforce men. And so it would be for the male network now to recognize, and this is why we share the information, for the male network to know this is what's happening. And so we can move this along, we can turn this around, and each one could bring one, and we can get tested together, and if somebody comes to be positive, we can support this person in treatment. And if the person is negative and there are risk factors or things that make the person vulnerable, let's address the vulnerability together as a group so that this person is not, would move on to become infected.
Where are we at as far as the availability of drugs and general treatment? Because it's a little unreasonable to expect that, given a small nation, maybe limited resources, we'll have all of the very absolute latest technologies. But where are we at as far as drugs and treatment?
So Trinidad and Tobago is one of the few countries in the Caribbean region that funds its entire HIV and AIDS program. There are activities that we would be involved in that may mean that we may access additional funding, but in terms of vulnerability with respect to funding, we are seen as one of the countries that is setting the example in terms of funding our own national programs. So there's that. But that being said, in order to be able to treat the amount of persons that we estimate to be infected with all of the changes in the guidelines internationally, we have to do look internally. We do have a very wide range of medication that that is available in different parts of the world, and the clinical team tends to come together around making decisions for what persons access. Sometimes we're not able to do it at that particular time, but in terms of scaling up treatment, what we would do is we will estimate what that looks like and price it, and then we would move forward. So it wouldn't be that we would just automatically start to treat additional people. And we tend to also have discussion with some of the persons living with HIV around changes in how we address programming.
And before we conclude, Dr. Sebro, we do appreciate you joining us this morning. What would you say to those who will say, as I was saying at the start of the show, we don't get the same much sort of attention for World Malaria Day, and more people die from malaria than die from AIDS. How would you respond to those who say, well, this is just because there's this Western fascination, because it affects Western civilizations and Western countries, that there's so much emphasis on AIDS, which ignores a lot of other life-threatening diseases. What is your perspective on World AIDS Day itself?
One of the things I would say, about HIV is that yes, there is that emphasis on it, but we actually have used the opportunity to actually strengthen a significant amount of activities that we do. So you hear us talk about World AIDS Day, but we do partner significantly with the STI program. We would also do other things in different programs. So for example, right now, one of the things that you will hear about, people talk about chronic disease, but persons who have HIV, who live for a long time, tend to get heart attacks and strokes. And so we would be very interested in terms of, for example, how we can diagnose and treat with some of those illnesses and the medications available. So while we do talk, you hear us speak a lot about HIV, we actually partner with a lot of agencies within the ministry and with a lot of groups to help strengthen a lot of programs that occur across
the board.
Across the board.
On the day and beyond.
Beyond,
in
yes.
that regard. Dr. Sebro, thanks very much for joining us this
me.
morning, and we'll probably try to get some water for that cough and to deal with that before you head out to work on this Tuesday morning. We have one more interview segment to come. We'll have a slightly extended edition of Morning Edition when we come back after the break.